We've added new features to Audioscan software for our 2025.1 software release. This video covers what's new for the Verifit2 and Axiom. As always, the no-charge software update is available for download at audioscan.com. However, for most clinics, the best software update method is using the Audioscan NOAA module. If Check for Updates on Startup is checked, then the module will notify you when new Audioscan software is available. You can also manually check by going to Settings and clicking Check Now for updates. If new software is found, select Download Now to download the latest software. Then click Install to initiate the installation on the Verifit2 or Axiom. So, what's new in 2025.1? New software features in 2025.1 include Probe Guide Plus, new calibrated speech map stimuli, sensory loss simulator stimuli, and anti-IEC tinnitus masker and hearing protection instructional content. Probe Guide Plus. Building on the success of Probe Guide Plus expands and improves real-time software-assisted probe tube placement. Probe Guide Plus adds the ability to guide probe tube placement for young children from age 1 to age 18. This is enabled via a new specialized model for pediatric ears, based on measurement data for probe tube placements on children and optimized via machine learning. The button for opening Probe Guide Plus has a new icon and is available on all screens with on-ear measurements. Probe Guide Plus retains its existing capabilities as well as a similar look and feel, but adds a couple of new important selections. The first is a toggle to select the probe tube depth prediction model. With the adult model selected, the tool utilizes a model optimized for predicting probe tube depth in adult ear canals. If you're placing a probe tube in a child's ears, click the toggle button to switch to Child. Child uses a new pediatric acoustic model that is optimized and validated for use with children, again, as young as a year old, up to age 18. There is also a checkbox to enable an animated dinosaur distractor that tracks the probe tube position in real time. The distractor can help young patients remain calm and focused during probe tube insertion. It can be enabled for any patient, independent of whether the child or adult model is utilized. As in the original probe guide, to free up your hands and avoid having to click Stop, check the Auto Stop at 5mm box so the tool stops when the probe tube is within the recommended 5mm of the tympanic membrane. Once Probe Guide Plus is configured as desired, the white indicator ball and dinosaur distractor will follow the probe tube movement in real time, with a chime and green checkmark to indicate when the probe tube is in the correct position, 5mm from the tympanic membrane. As always, cross-check with otoscopy and utilize the black marker on the probe tube to ensure the position of the probe tube does not change. New calibrated speech passages. We've added new speech passages that have an equivalent speech spectrum to the ISTS, resulting in the same measurements, but enable more options for speech in a client's native language and on more engaging topics, allowing you to switch between speech passages at your discretion to enhance your patient's experience. The first new speech passage is a pediatric speech passage called Speech Ped. It's a friendly speech passage about dinosaurs that pairs well with Probe Guide Plus, and will help engage young patients. In addition, we've replaced our English male speech passage with a new carrot passage spoken by a male. We've also added a new French-Canadian, French, and Arabic carrot passage. In Setup within the Speech Map tab, you can add or remove speech passages that are calibrated for use with prescriptive targets in Speech Map. Any speech passage that is calibrated for targets has a speech spectrum equivalent to ISTS, so any signal can be used depending on your preference and the speech passage that your patient will appreciate most. Sensory Loss Simulator Stimuli. We've enhanced counseling by adding new stimuli to the Sensory Loss Simulator, an effective tool that helps family members experience sound as the patient hears it, deepening their understanding of the impact of hearing loss. The Sensory Loss Simulator is accessed via selecting Counseling from Speech Map, and then selecting the Loss Simulator button. Once you're ready to counsel family members, you can choose your preferred stimulus for the simulation. In addition to the stimuli previously available in the Sensory Loss Simulator, all calibrated speech passages selected for use in Speech Map are now available for Loss Simulator counseling demonstrations. Instructional content enhancements. New instructions on interpreting anti-IEC test results provide details on test tolerance for each test, so you can more easily determine if hearing aids are functioning according to their factory specification on the hearing aids datasheet. New instructions on tinnitus masker verification provide a simple measurement method for measuring tinnitus masker output using the Speech Live setting in SpeechMap, so you can determine appropriate audibility for tinnitus masker signals. And new instructions on hearing protection verification provide a method to evaluate hearing protection using insertion gain, to help you better understand how earplugs and other hearing protection attenuate sound. Thank you for taking the time to learn about the new 2025.1 Audioscan software features. Full instructions are available in the updated Verifit2 and Axiom user guides. For more information, please visit the Audioscan website, our YouTube channel, our Audiology online page, and our LinkedIn, or feel free to contact us by email.